Hi, Jessica. Welcome. Oh, that light in the back is horrible. I wish I could mount this somewhere. Hi, Morat. Welcome. That light in the back is driving me crazy. And I think I just broke my thing, this little mount thing that I use for this. Hi, Andre. Hi, Shane. How are you? I'll mount this back here, see if this works better. Have you thought of continuing videos even after? You know what? Someone actually gave me that suggestion earlier today. Because we only have about a week left, and she said, you know, if I could still do, continue doing videos. So I mean, I might do them every now and then, probably not daily the way that I've been doing them, or by request. I mean, I whatever topics you guys want to know about, because I think that's sort of like the hard part for me is like, what do people want to know? So I might do that. I might do like a Q&A session at the end of the month, and then I'll ask you guys like what topics you want to know about, or if you guys have any questions regarding my own personal story. But my story is also kind of, it's a lot different than some other people's stories, and I don't want to scare anybody with my own personal you know, stuff that's happened to me, because I don't think it's representative of every Lyme patient. But yeah, I'll keep talking about it. Yeah, I mean, that's the thing, is that it's like, you don't want to scare people and, you know, take away their hope, but at the same time, you want to talk about your story and be realistic about it. You don't want to lie either. So that kind of can be a thing. But I actually saw something interesting in Redbook magazine. So let me find it. But what was I going to say? I felt like my scope earlier was not good at all. And I really wanted it to be good, and it just was not. I don't know. I felt like it wasn't one of my best. So I was like, oh, I'll come on for a little bit and share some other stuff. I had found something in Redbook magazine. Thank you. Thank you. Yeah, I don't know. Sometimes, like, when I don't prep for my scope properly, it just doesn't go well. And I want to make sure that, you know, whenever I talk about something, that I'm prepared, or that I at least have some kind of direction, you know, when I'm scoping. So, oh, thank you for inviting followers. So Redbook magazine in the United States, because I'm assuming it's different in other countries. June 2016, Redbook magazine has a little something on Lyme disease, and I'm trying to find it. I talked about it, I think, in my earlier scope. Hi, hello, welcome, welcome. See, I should have been prepared. I should have been prepared. And then I'm over here multitasking also, because I'm doing some stuff on the computer. Hi, Joey Good Vibes. Welcome. And also, by the way, hi, Stubby Nubs. If you guys want more information about my Lyme, you could visit www.ucaring.com/Marisol has Lyme. I was sick. Well, according to the doctor and from all the stuff that I told her, I was sick for about 7 years when I started seeing her. And I started seeing her 3 years ago. So I've been sick for a grand total of almost 11 years. But she asked me, I mean, it was like a 3-hour appointment. She asked me for all of my medical history. Like, she told me, think as far back as you can, all the way to childhood. And I was like, I have a pretty good idea where this started. You know, it was probably around my senior year in college. So around 2005, 2006. I don't think it was. I don't think it was any time when you mean sick symptoms. Yes, I first noticed symptoms in 2000. Well, I didn't know that they were Lyme symptoms. I just started having major issues around 2005, 2006. Before that, I was in relatively good health. You know, I always kind of had some like anxiety issues since I was a kid. But to say like something big happened, severe pelvic pain. So it's kind of more of a woman issue, I guess. But it started with severe pelvic pain, even like really bad gluteal pain. So even sitting down was painful. You get Lyme disease from a tick bite. So if a tick bites you and it has this bacteria, then it transmits it to you, and then you get it in your bloodstream. If it's not treated within, the first 30 days, then it typically gets worse. I mean, I think sometimes even if it is treated within the first 30 days, it's really bad. Hi, Orlando. So yeah, okay, I found it. So Redbook, yes, I do have co-infections. I have 2 that they found, but I think that I probably have more than that. I have, what are the names? Mycoplasma and anaplasma, I think is what they're called. So they're like bacteria. You have Babesia. Oh, I heard that one's a tough one. I spoke to a guy that had Babesia, and his personal journey was also, pretty bad. We were kind of neck and neck with our struggle, and jumping. He had already seen a couple of other doctors. Some people are treated successfully. The night sweats are horrible. I recently started having night sweats, but I don't think it's from Babesia. I think mine are more like hormonally related. Hi, Omer. So in the June 2016 American issue of Redbook, they have a little something about Allie Hilfiger. She's Tommy Hilfiger's daughter, and she has Lyme disease. So I'm going to read it to you guys really quick. I really want to get this book because it looks like it's probably really good. So it says, Allie Hilfiger was 18 years old when she woke up in a psych ward admitted by her parents, famed designer Tommy Hilfiger, and his then wife Susie, in a desperate attempt to make sense of her outbursts. Soon they would have their answer. Allie had Lyme disease, a bacterial infection that had crept into her brain after more than 10 years of physical symptoms, ranging from joint pain to nausea, that she started to think were normal. She spent her childhood accepting what those around her said about her health, but the message in her memoir, Bite Me, is clear. You know your body best. Listen to it and insist on real answers. So this is, a pretty unique story. Thank you for sharing. I really want to get my hands on a copy of this book. So, once it comes out, I'll probably have to get it online, and when it comes out, I'll read it, because this is like a very different case. It seems like a unique case because most of her symptoms, or her worst symptoms, were like psychiatric, and you don't really hear a lot about that at all. I did, that was one of the things. That was one of the things that improved for me when I went through. That was probably like the only thing that improved when I went through antibiotic treatment. I had some short-term memory issues. And I'm going to be playing some music here because I want to import some songs. I had some... Hi, Dianica. And my short-term memory was bad. I think I talked about it in a couple scopes ago that, I would... yeah. It affects a lot of things. It affects you neurologically. It affects your muscles, your joints. It affects a lot of things. But my short-term memory improved. So I used to, like, bladder vision. Yeah, it affects your heart. It affects a lot of things. But I feel like my memory did improve, especially short-term memory and my spatial awareness, because I used to like bump into things and stuff like that. Those two things I can say did improve. So I wouldn't. I mean, I'm still kind of forgetful. I have my days, but not the way that I was before, where I would, I would go to the mailbox, come back to my apartment, and try to open the door, even though I knew I had locked it. And yeah, I would constantly do that over and over and over again. And then, like I said before, putting the glass on the shelf and always hitting the shelf, that improved too. So I mean, I'm not perfect, but I got something called a PCR test. I believe it's called polyclonal reaction test. And that's how they found it. You can't get the standard test through like Quest Diagnostics or one of these routine laboratories. They don't, those tests, the standard tests do not work very well. Trying to find a song here. Yes, Eliza has a bad test. So the PCR test was what helped me the most. And it even came back with a picture of the bacteria. So I have a positive PCR with a picture of the actual spirochetes in it. So it was, kind of interesting, but at the same time, it's like, oh, why do I have to see this thing? So positive Western blot, but negative ELISA. It's tough to get positive on the Western blot, isn't it? Through iGeneX. Yeah, mine wasn't through iGeneX. I think mine was through Advanced. I think it was called Advanced Laboratory Services, and it's on the West Coast. And I was positive through PCR. I mean, it was super expensive, but at that point, I was so bad. I already had the light sensitivity. I was just, I couldn't work. I couldn't do anything. I still can't work. I still can't do anything, but I was just desperate. Yeah, I was just desperate for an answer. I hear iGeneX is pretty pricey too. But I had the PCR test done. I heard the Western blot can be faulty as well, but I mean, I think any test can be faulty. Sometimes the Lyme disease isn't even your biggest issue. It's one of your co-infections, like you said, Babesia, or Mycoplasma, Anaplasma. I have Candida issues, so I have to really keep my sugar intake low. That's what I was talking about on my scope earlier, because I have Candida, and that causes like a lot of fatigue and skin problems. So some people, the Lyme isn't really even their main issue. It's the co-infections and just how weak your immune system gets because of just the attack of all of these infections. So yeah, hot and cold at the same time is so strange from Babesia. Yeah, Babesia, I heard Babesia is just rough. I think I did have Candida before the Lyme. I think I had like mild Candida before I even got infected with Lyme disease, but it definitely got worse. It got worse once I got infected with the Lyme, and then one of the first things that happened to me, or that I believe happened to me after I got Lyme disease, was I had a really bad stomach infection. And this is also, I heard that this is a co-infection as well, H. pylori. And usually H. pylori in a normal person, or your average person with a regular immune system, it doesn't really bother them. H. pylori is responsible for like acid reflux. Hi, Crazy OT. But most people manage it okay, or they're asymptomatic with H. pylori. I was not. I felt like it was like chewing on me from the inside out. Hi, little J. It was horrible. It was so horrible. And I started losing a lot of weight, and I was just like, I told my parents, I said, something is really, really wrong with me. Like, I just feel so sick. And, of course, because I had already been complaining about stuff, nobody believed me. And, eventually I just kept putting up a fight. I have not, I'm fortunate that I have not lost my hair, but I know quite a few people that lose a lot of hair with Lyme disease. Um, so I'm fortunate in that way that I did not lose my hair. I mean, who knows? It could still happen. But no, that's one thing that I'm fortunate. And a lot of the supplements that I take, I think tomorrow I'm going to be talking about supplements, or the supplements that I can still take. And most of them are for like tissue repair, and they also benefit your hair and nails. So that's kind of keeping me. Is your brave for talking about this? Thank you, Joey. I don't know what that MTHFR is, but she did test me for biotin. I used to take biotin, but then my hair grows like super fast. Hi, EE. I have a multi-susceptible. It's called the dreaded gene. That's what the doctor calls it. I don't know if it's the MTHFR. I just know it as the dreaded gene. It's multi-susceptible or something like that. So it's just, I mean, that's the reason why I'm still in this situation, because I have this genetic thing that's really really tough to deal with. So same here, MTHFR. Yeah, and that kind of stuff makes it, so much harder to be treated successfully. And okay, yeah, I think it's probably the same thing. I just don't know the technical name of it. Yeah, we don't detox properly. That's one thing that she did tell me, is that we don't detox the way that we should. So we have to manually detox. I know that every time I see it, the MTHFR, I think of that. That's the first thing that comes to my mind. It's such a profane name. But yeah, that's what she told me. She says you don't detox on your own. You have to manually detox. So I take stuff like apple pectin, and she told me to take activated charcoal, which I can't tolerate it. It hurts my stomach. Went blind in one eye, so I feel you in this situation. Oh my God! Wow, that is, going blind after having vision, I think, is just such a tough thing. That is really it's one thing to be born blind. I think it's another thing to actually go blind when you had vision. That's really tough. Yeah, that's a really rough one. So yeah, that's rough. I mean, I have light sensitivity, but at least I can still see. It's just I have to avoid certain types of lights, like this laptop. But yeah, I mean, sometimes you just have to keep going. So yeah, so I do have that that issue with the detox stuff. So yeah, it's rough. Do you think we can be cured at this stage? I'm not sure. There are other types of treatments, but they're hard to get a hold of, and that's what I'm looking into. You just sometimes need a concrete diagnosis. I'm looking for a different, because I feel like I have a lot of neurological issues, and there's got to be something to help these, like there's people that have neuropathy. A lot of people with Lyme disease have neuropathy, and there's so many types of neuropathy. So right now I'm looking into that. There's people that say that these diseases were created for biological warfare. You know, there's a lot of that. I mean, I'm not saying that it's not true. I'm not, I don't know. I think at the end of the day, it doesn't really matter if they were created for biological warfare. I think it's just, I think people are just trying to look for some kind of an answer. We're grasping, grasping at straws. And at the end of the day, it's like, does it matter what it was created for? You know, it's a disease, you know, and it's hurting people. I am on disability. I've been officially on Social Security disability for, it'll be 2 years. It was 2 years this past September, but I stopped working, I stopped working 4 years ago, I think, 3 or 4 years ago. I think it was 2011 I stopped working. So probably almost 5. Because of the light sensitivity. Like right now I'm on the computer, but it's hard to get for Lyme. The disability, I had to get like a, what do you call it, like a lawyer or whatever. So he took a big chunk of, you know, my money, but unfortunately, 8 years in August. Okay. Yeah. But I think it's easier to get SSD with blindness. I think there's a little bit more, it's a little bit more forgiving. So, but I'm not blind. That's the thing. I'm just sensitive to the light. Like, I'm on the computer right now, but I have probably a good, 15 minutes left until it really starts bothering me. Okay. What other issues do you have? I have these like plastic things on the screen of this laptop, and it makes it hard to see the screen. You can't digest anything. Ooh, yeah. Yeah. And sometimes you don't absorb. If you can't digest it, you're not absorbing nutrients, and that's why, we tend to be malnourished and all of that. I knew a guy, I talked to a guy at my old doctor's place, and that guy, he had like chronic diarrhea all the time. Kyphosis. Why I position for my lung surgery. What is kyphosis? Yeah, my doctor recommended pureeing my food. I read a story about a girl with Lyme that couldn't eat solid food at all. Like everything had to be pureed. I have some of my food I eat pureed, but a spine problem. Okay, yeah, that can cause like a lot of neurological stuff. Yeah, like I still want to eat some kind of solid food. I hope I never get to that point where I have to puree everything. I know, right? This is the scope. This is the place for hot messes. I welcome every hot messes. Exactly. There you go. You're in good company. GMOs, yeah, GMOs and stuff. If you guys don't already watch Hurricane in Heels, she has lupus. Her name is Kelly. You should watch her, Hurricane in Heels, and she talks a lot about like food, things like that, organic food, eating clean, and just that kind of thing. And she's really good about talking about it. She's a little bit better at speaking than I am. I kind of get distracted and get sidetracked and stuff. Thank you. I try because a lot of times I watch other people's scopes, and there's some people that are just kind of like sitting there and they're just like, ask me questions, which I will do. Like I'll try to do like a Q&A at some point, but also too, like if you have something, something to say, or if you have some kind of life experience, you want to really talk about it and really get it out there. Free for public, like in schools, hospitals. I wish I could, but I can't go into schools, unfortunately. And I can't go into hospitals either, so hopefully I never have to be hospitalized. I'm sensitive to the lights there. I used to be a substitute teacher right before I got really sick. I was working in an office, then I started getting sick, and I went back to substitute teaching because, you know, I started going to different doctors and things like that, so I needed a flexible schedule. And, I mean, there's fluorescent lights in every school, probably in the United States. And I had to just stop working completely because the fluorescent light, some people say like, oh, you know, yeah, I get a headache from fluorescent light, and it's like, no, this is not a headache. This is like severe head pressure, nausea, disorientation. I mean, it's really bad. It's really, really bad. So, I mean, it's not your run-of-the-mill light sensitivity. You know what? I've never exposed myself long enough to the light, but I do think that it can cause a seizure. I kind of suspected that I might have had a seizure really early on when the light sensitivity first started, but I was asleep. I just kind of got like a weird sensation, and, you know, I woke up and I just felt like weird, and I wasn't sure if it was a seizure or what, but I mean, I've never exposed myself long enough to find out. And I have to get off this computer soon, too. So, I'm just trying to upload my latest scopes to YouTube, and then I'll get off of here. I'm going to sleep it. So yeah, that's me. I just came back from a graduation party a little while ago. So I'm trying to get out. A lot of times I get invited to stuff, and I just because I just don't want to go, you know, I won't go. But lately I've been feeling like I need to get out. I just need to like get out of the house and do stuff, you know. Thank you for the hearts. But yeah, I just need to get out and do something, and I'm just such a hermit. Yesterday I went to my nephew's birthday party. Today I went to the graduation party. Next week I have a baby shower that I hope I get to go to. Hi, Laura. Yes, I have both anxiety and depression. I am embarrassed to go out sometimes. Actually, as a matter of fact, this week I'm going to talk about some body image stuff as well, but I'm wearing this dress. I don't know if you guys can see what I'm wearing. So I'm wearing this. And I'm going to have to talk quieter because I'm going to talk some crap right now. But I got this dress. I really like this dress. And I was like, oh, it's a dress that fits because I'm so skinny that like nothing fits me anymore. And so I walked in. Hi, Dougie. And I tried it on. I went to my mom and my sister, and I was like, look, I got this dress and it fits. And they're just like, you look so skinny. All of your bones are showing. And I was just like, so I haven't been wanting to wear this dress at all. And finally today I had an occasion. I know, right? I'm just like, why do people have to say things? And I'm going to do a whole scope on that, on body image issues. And I was like, no, I like it because it fits, because everything fits me so big now. And this dress actually fits nice, you know? And I was like, you know what? I'm going to wear it. I don't care. So I wore it to the graduation party. I do have a sweater on over it, but I wore it. I was like, I like it. I'm going to wear it. You know, I don't care. Yes. It was so weird. When I was doing the long-term antibiotics, I swear to you, my stomach would swell and it looked like I was kind of pregnant. It was weird. And I'm so skinny, but it would swell. I think it's from, like candida issues. Yes, I did lose a lot of weight. I think I was the heaviest that I had been probably in like in a long, long time when I first started getting serious, my neurological issues. So I was, I think, 106. And right now I'm about 90 pounds. During treatment, I went all the way down to 83 pounds. So this is not the skinniest that I've been. I've actually been skinnier than this, which is really scary. I've never been overweight. No, I've been pretty thin. Like, I've been skinny my whole life, but this is ridiculous. I mean, this is really a lot. Way too skinny. Way too skinny. And 83 pounds is just completely unreasonable. I'm like 5'5" tall. So thank you. Thank you. Yeah. I think a lot of it is just sometimes having to just have the confidence to, it's like I put on the dress and I was like, I'm going to wear it. I bought this dress. I'm going to wear it, and who cares? I have to stop caring so much about what other people say. And I'm going to do a whole scope on that, because I think that's something that people don't realize, is that your body image and your self-esteem gets hit really hard. That was something that I didn't even expect when I got this disease. Just how my self-image just totally, I mean, not that I had, a lot of self-esteem before, but just the way that it sort of warps your thinking and your perception of yourself. Yeah. And it's weird, because that's something that, I never expected that, when I got sick or when I got diagnosed. You never hear people that are sick say, oh my God, like I don't, I look in the mirror and I see something totally different now. It's the focus is more on, their pain and isolation and stuff like that. But there's, your self-image and your self-confidence just totally takes a huge hit. So that was like one of the big things that I didn't even anticipate. So thank you for the hearts. Thank you. So tomorrow I'll probably be talking about supplements. I'm probably going to be talking about makeup and stuff this week. I'm so scared to go once. It was terrible. I can't talk randomly unless someone talks. Yeah, sometimes you kind of have to be prepared with a topic. Yes, some people go the opposite way with Lyme disease and they gain weight. Some people lose a lot of weight. Some people gain a lot of weight. A lot of weight. So, yeah, you can go one way or the other. And I've met people that gained weight because of their Lyme. And I've met people that have lost a lot of weight. I think there was one lady at the Lyme disease group who was a size 14 and she was a size 6 when I met her. And I read her story and she said, I used to be a size 14. And I was like, oh my God, I could never imagine her as a size 14. She's this, skinny, lady with short hair, and she was a size 14. I can't imagine that she was ever a size 14. But yeah, she lost all that weight because of her illness. And I mean, I've lost a lot of weight. I gained a little bit and then I lost it again. And so it's just kind of, back and forth. It can mess with your thyroid, or it can just mess with your digestive system. In my case, yes, gain, lose. A lot of people do that as well with Lyme disease. I think in my case, it's just my food sensitivities and just all of the digestive issues that I have. I mean, I can't eat a lot of stuff. I have a lot of digestive problems. That's why I'm skinny. I don't really think it's more complicated than that. But yeah, I do have a little bit of a thyroid issue, but I can't take thyroid medication. I'm pretty lactose intolerant at this point. And if you guys haven't seen my scope from earlier today where I talk about my food sensitivities, check it out. I talk about all the food sensitivities I have. I think it's hyper, right? I think it's hyper if you lose weight. I did not have leap testing. It was like process of elimination, to be honest. I just, because I started having so many bad symptoms, the doctor just took me off of everything. And little by little, I would try to incorporate things again, and I would just react badly to them. I just figured it out on my own. I mean, my symptoms were so bad that I could put two and two together. I actually had today I had 2 Rice Krispie treats and a bunch of little chocolates. I never heard of the leap test. What is that for? I had like a lot of sugar today, so I know I'm going to either be feeling that tonight before I go to bed or tomorrow morning when I wake up. And I'm going to probably break out everywhere. So I know which things, what triggers what. So when I eat something, I know what to expect. Like I had Malibu rum a couple days ago and I woke up and it was just like joint pain all over the place. I mean, all of my joints were hurting. And I don't usually have, as long as I stick to my diet, I don't have joint pain like that. So I'm pretty good. You know, I know a lot of people with Lyme disease that have severe joint pain and they just feel horrible. And, you know, I'm lucky that I don't have that severity of joint pain. Oh, wow. That does sound expensive, though. That sounds really expensive. I don't need to have my white blood cells measured. I just have to eat something. Like if I have, say I have a handful of like almonds, I'll start breaking out in huge. I have a prescription for medical marijuana and I did not react well to it at all. I can have a handful of almonds and I start getting, I don't know if you could see right here, I have like a big, well, it's going away. I have like a big cystic pimple. And I'll get big cystic pimples. They don't come to the surface from almonds. And I also start bleeding from places. So it's really, you know, it's not so much an allergy as it is a sensitivity. Yeah. Thank you, Joey. Yeah. Cause an allergy would be like, hi, welcome. An allergy, I think, would be more of a like rashes and like not being able to breathe. This is just like I get acne, you know, and then, you know, I start bleeding. It's almost like my body doesn't process the food properly. And so I just start having all these weird issues with it. Do you have Lyme also? Yeah, Lyme disease is it's becoming so common all over the country. So, yeah, it's pretty crazy. But I think I'm going to start prepping for tomorrow. I don't know what time it is. My phone's over there. So, I got to start prepping for tomorrow, talk about supplements. I'll probably talk more about the food sensitivities, 1039. So I'm guessing you're somewhere where it's 3 hours different. Where are you from, Joey? This just makes me feel like I do. Oh, so do you have symptoms, Stubby? What time will you be scoping? Tomorrow, I'll probably do... You're in New York. Okay, so that's a 3 hour difference. So it's probably like around 7:40 over here. Tomorrow, I'm trying to think if I have anything to do tomorrow. I usually do either like 10:30 in the morning or like 12:30 to 1 o'clock. So I'm not really sure. It depends on how much, it depends, but I always leave the replay up. And like I said, I'll try to do like a Q&A session because I know, Mary, who also watches me on here, she also has like a lot of questions and I feel like I can't answer questions when I have a specific topic. So I'm going to have to probably do like a few Q&A sessions at a different time of the day, since this is the last week that I'm going to be scoping about this. So I'll try to fit that in. So if people have questions, I mean, I'm not an expert on this disease by any stretch of the imagination, but I know people do have questions, especially people that haven't started treatment. You know, people have a lot of questions, what to anticipate. Okay, cool. All right, I'll see you later. So I'll try to do that. I'll try to get some Q&A sessions going. And I will talk about, this week I'll try to talk about my my treatment story, because I haven't even talked about my treatment story and how I got treated for Lyme disease. And I know that before I got treated for Lyme disease, I really was hoping and praying that, good night, have a good one. I was really hoping that someone could tell me this is the way that your treatment is going to go, and I really didn't have anybody to tell me that. So at least I can give sort of a description of what happened to me from beginning to end, because it was like 7 months of just craziness. But yeah, so I'm going to go. Thank you guys for sharing. Thank you guys for giving me hearts. Yes, it was, the beginning was okay. The end was a nightmare. But it's a long story, but I'll try to dedicate a scope to that. But thank you guys for being here. I just wanted to do a quick one in the afternoon because I know my scope earlier today was kind of crappy. So, okay, thank you. Follow me and I'll follow you back. Thank you guys. Thank you for joining me, and I will see you tomorrow.